Welcome to Vitamin B with Mohana. This is where we help you take control of your well-being. Our heart is such a primary aspect of our lives, yet most of us know someone who is suffering with a heart disease. Why is that the case? Today, the renowned cardiologist Dr. Ranjan Shetty is joining me to have an important conversation on India's struggles with heart diseases. Why are there increasing cases of heart attacks? And essentially, he is here to help us understand how can we live with a good heart and a healthy heart across all the decades of our lives.
1/3 of heart disease, even now, don't reach hospital. The blood test. And if the lipid profile, LDL, that's the only number we look at.
Okay. The crazy world of what diseases are happening, etc. What is good heart health supposed to be?
Heart disease is a lifestyle disease. That's the reason why it's increasing, because the lifestyle has gone wrong. Exercise between 0 to 10. 0 to 1 has maximum benefit. Heart attack is common in women. They are not fully protected.
Younger and younger people are getting heart attacks.
Yes. Again, extreme exercise like marathon are harmful. Most of the time trigger is either stress, you have a gene which is responsible. But the trigger, although if you're born with this, even though it is a loaded gun, the trigger is still in your hand. So it's important to know, we understand that. A marathon is supposed to be part of midlife crisis. Who have had heart attack, 90% of them have been smokers. 90%.
Significant change that has happened in society today, right? That's pushing us towards these increasing cases.
So women also get heart attack. I think it's important to remember, unlike a virus, unlike a bacteria, heart disease is what you have created most of the time, that we need to go back to our grandmothers.
Yeah.
The balanced diet is the way.
But doctor, I do want to say that, yes, you take your medicine, but that doesn't mean you stop taking care of everything else.
The easy test, get your lipid profile done at the age of 21. Exercise first is how much?
Yeah.
It should be like a prescription. Marathoners look 5 years older than their counterparts. They don't look younger. Their body is not younger. But other risk factors are diabetes, hypertension, smoking, sedentary lifestyle, high carb diet what we take, genetics, and stress. So what we encourage is around 150 minutes of exercise a week.
So come, join me in this important and essential conversation. Sit back, relax, and I'll see you at Vitamin B. So Dr. Ranjan, it's wonderful to have you on Vitamin B with Mohana.
Thank you, Mohana. I've been looking forward this for a long time. I'm happy that we could be part of this year.
Doctor, it's unbelievable. I have been talking to a number of other people and they all are quite excited because you're a very renowned cardiologist. So we are humbled to have you on, the show as well. Yeah.
Thank you.
How are you doing today?
Today is fine. It's good. I think it's, all these things should be done early morning. So I'm very happy you're starting it early morning.
Yeah, I think for the audience as well, we always try to record first thing in the morning as is good industry practice. The lights are great. The sound is quite quiet in Bangalore as well. So it's good to have you. I think we're here basically to talk about something which is close to your heart. You live it every day as well. But I want to start by acknowledging the fact, doctor, that growing up, we always heard of heart diseases, heart cases. But today, there's a 1 degree separation. There's almost someone I know who actually in your family or friend circle has a heart problem, right? And before we dive into that crazy world of what diseases are happening, etc., what is good heart health supposed to be?
Yeah, I think it's a very good question. And the key here is to realize heart disease is a lifestyle disease, and that's the reason why it's increasing, because the lifestyle has gone wrong. So I feel it's important that we acknowledge this fact. And once we acknowledge it, everything falls in place. So when you say lifestyle, obviously lifestyle is about more than one thing. Maybe we will be discussing about all of them in your subsequent questions. I think it's important to remember, unlike a virus, unlike a bacteria, heart disease is what you have created most of the time, or you're born with it. You have a gene which is responsible. But the trigger, although if you're born with this, even though it is a loaded gun, the trigger is still in your hand. So it's important to know we understand that.
Wow. I would have always thought that it has something to do with primarily your genetic composition.
Yes.
And yes, we all should acknowledge that there is a sense of significant change that has happened in society today, right? That's pushing us towards these increasing cases. So what exactly is happening in India today, doctor? Can you throw some light?
I think, if we have to compare to, say, our ancestors, and I see that you are very connected to your roots, so it's good to go back. If you go back, say, 80 years, 60 years, or peri-independence time, the India was different, the country was different for multiple reasons. Although the development in medical science had not come to the extent we know now, the lifestyle was better. And for most, lifestyle was compulsory. The food was limited. It was a resource limited setting. So the people, what we advise now to make people to have less meal, control would happen naturally. People had to walk. There were no buses. There were no transport. They had to walk, and predominant rural India and most of urban India was like work was more, blue collar. You had to work it out. You're a farmer or you're walking. So whatever exercise which we think is needed, say we tell people 20 minutes you do, it's natural to them. So I think that is the difference which occurred. But it's not that people then lived longer. I mean, it shouldn't go with the message that there was longevity. There was no longevity then. So then, people would die at the mean Indian survival was 47 years, which has now grown up to 72, 68 to 72. So the message I want to give is, we have done a lot of things right. Obviously, we are living longer, but we need to be more careful about how we do it so that we can live still longer. Now it's possible. Then, one typhoid would kill people, and however healthy you are, you may be muscular, you might have six-pack, but a single typhoid would kill. Now, as we are controlling these diseases, it's important to extend your life by controlling other controllable risk factors.
So what's the state of heart disease in India?
Yes. Now, it's very prevalent. If I have to just tell in one sentence, but if I have to throw some numbers and this and compare it to West, it's still responsible for 1/4 of the death. That means 1 in 4 people would die of heart disease. That means 1 in 4 people would have heart disease. That's something which we should understand. But the key thing is not about having heart disease or not having heart disease. I believe, I'm sure you'll get it, Mohana, that finally if you have to die, which is a reality, probably the best way to die is heart disease. The worry is having it younger. And that's where Indian versus Western demarcation starts. Even in West, 25% die of heart disease. And probably better way to die, as we discussed. But Indian versus Western, that means Indians, when they have heart disease, they have heart disease 1 to 2 decades earlier. The mean age of Indian heart disease is around 50-55. That means 50% of them get it younger than that age. Mean is very, it pulls it up. So if you say median age, it could even be less than 50. So that means predominant Indian heart disease is at a very young, productive age group. And what we should accept is, although the medical science is improved, 1/3 of heart disease, even now, don't reach hospital. Still very bad disease. Still very fatal. People just wake up when there is a celebrity event or celebrity death. But you look around, like you said, Mohana, that, it's happening every day to our near and dear ones.
So, so are we seeing, or can we say that at least the numbers that I have read, right? But it's always important that you can validate that, right? There is a increase year on year, very clearly.
Absolutely. And I would like to, at some point in this discussion, like to touch upon why there is an increase. We could go to that.
We can talk
Yeah,
about that. Why is
okay.
there an increase?
Yeah. So I think that's the key question. I think there are two questions here. Why there is an increase and why are Indians prone at a much younger age group? It's believed that we have clustering of risk factors. Now for heart disease, there are 8 or 9 risk factors. One of the main risk factors is obviously age, which is not changeable. Men are more prone than women. That we know. But other risk factors are diabetes, hypertension, smoking, sedentary lifestyle, high carb diet, what we take, genetics, and stress. Now, what we see as Indians is there is clustering of risk factors. That means Indian diabetic is 2 decade early diabetic. He or she is also hypertensive, is also maybe sedentary, is also not taking proper diet, not exercising.
So it's a combination of things that are leading to
heart attack. Just to say, as a race, we are tuned to one risk factor being high. For example, if somebody has BP 200, 100, everybody gets scared. Oh, it's 200. But when the BP is 150, we think it's okay. 130 is normal, 140, 150. All diabetics say, I have sugar, but it is I have controlled it. In the sense when glycemic is 7, whereas 6.3 is normal. So, but what they don't realize is the risk factor, the 200 is bad. But the risk of 200, if you take it 2, a risk of diabetic, hypertension, smoking together will be each multiplied by 2. That means it will be 2 to the power 3 when you have 3 risk factors. And now the chance becomes 8 times. And you think you're okay because you look okay, you feel okay. So clustering of risk factors is important. So my advice is if somebody is say diabetic or hypertensive, it's important to control that risk factor. It's also important to see that one more doesn't come. We are like all or none people. Either we want to be very healthy, which is a very small percentage. But if you have one, we are okay having one.
It's so sad, right? And actually, you are looking at younger and younger people looking bigger. And it was not like that. I can't say that more, it's become too obvious, right? But staying with the flow, right? Heart attack is not the only heart disease in India, right? So what are the top diseases regarding heart?
This is when I usually jokingly say that if it was just one disease, most of us to become cardiologists have to study 11 and a half years. If it was one disease, obviously you don't need to study so much. But yet the predominant important disease is heart attack. By that, what we mean is there is blockage in the artery which supplies the heart. The disease in the small arteries which supply is heart attack or heart disease or coronary artery disease. Now, if there are problems in muscle, that also is a heart disease where muscle becomes weak. That's what we call as heart failure. Now, there could be holes in the heart, abnormal connections. These things predominantly occur in, people who just grew, the newborn child and children. So they have a different set of heart disease. Hypertension is a very, very important heart disease. Then we have heart disease, electrical problems of the heart. Heart, although it's a beautiful organ, has its own electricity. So if there are problems there, heart rate could go down, heart rate could go up. Going down, people need pacemaker. Going up, they need to be shocked. Then there are diseases like atrial fibrillation, which is the chamber of upper chamber. There are also diseases of the covering of the heart, which we call as pericardial diseases. There's a huge set of diseases which occur, but the hero of the show is heart attack, and others are like background players in a, sometime in a dance you don't even see what is behind. At least people don't see what is behind. But as choreographers, I think we need to see everything.
That's beautifully articulated on a very difficult topic, right? So heart attack, right? Why is it that younger and younger people are getting heart attacks?
I think the key, especially in India, is clustering of risk factor. So if I look at the youngest subgroup, like for example, the youngest patient I've done angioplasty is probably 24 or 25 with a heart attack. And it's very common to see around 30s. If I look at people less than 35, who have had heart attack, 90% of them have been smokers. 90%.
At some point, even if they've left it
Yes,
now, right?
yes. Most are current, but yes, present, past smokers. So it's important to look at that as a risk factor. Now it's been a single, when I say 90%, it's obviously a very big number. So when you have very, very young people, say 35 and less, smoking becomes a very, very important risk factor. It can't be even a single cigarette. As I say, smoking is like poking in the tube of a tire.
Yeah.
One of them will, or maybe fine, tire may be okay. See, in this case, the intrinsic tire is okay. But smoking is the one which is making it. If they had not smoked, maybe they would have had heart attack or never had heart attack.
Okay.
So that's a key risk factor. When you look at maybe from 35 to say 55, that's where we see clustering of risk factors. They are diabetics. Indians are diabetic by 30. So they're diabetic, they're hypertensive, some of them are smoking, lipids are on high, they're obese, they have sleep apnea, things like that. When multiple things combine, and some unfortunate people are purely genetic, as you put. Above 55, again, it's these risk factors. So if if you're a mathematician or a statistician, if you like, if you draw the graph like this of heart attack, cumulative heart attack increasing, the graph always goes up. But if you have less risk factor, it is more flat. If you have zero risk factor, it is definitely flat, but that's not possible. So there is an incline, age on age, decade on decade, increased risk of heart attack. But if you have risk factor, what could happen at 80 could happen in 50. And if you smoke, it could even happen in 30s.
Okay, understood. Wow. Okay.
I think if that one message of smoking goes out, I'll be happy, because that's the
for almost everything. That's what I'm hearing. Right?
Yes.
But then you talk to a smoker and they'll say, no, it's not the case. They don't,
they don't relate, but it is the case.
So true, doctor. So the last 2 months, I've had 2 people in their late 30s get heart attack. One, it was quite extreme. They did not realize that they had a heart attack. And the other one was driving to work and she could feel a pain, and had a mild heart attack. Went and got herself checked up, right? Both do yoga, both do meditation, both eat home food. One used to be a smoker a long time back, but has left it. But the point is, why are people like this, who are making an effort to actually for years to keep themselves quite healthy? They're even doing breath technique, staying fit, they're not drinking, they're not doing any of that excessive stuff. Why are they getting heart attack?
I think that's an important risk factor again. Important topic to discuss. As I told, majority at that age are smokers. Now we need to look at that 10% who are not. Again, when we talk about numbers like way we do, we are looking at numerator. We are looking at you have one of these. We don't know one out of how many. So that how many is still a small number when you talk about less than 35. The denominator is bigger. But the numerator strikes you. But when we analyze these cases, it's also important these 2 were out of how many.
Got it.
There could be 1,000 people and these were the only 2. Then the important risk factor for a youngster, other than smoking, I would rate stress, lack of sleep, lack of exercise, or food fat sometimes. They think certain food is because in an urge to lose weight, you could have a food fat which is equally dangerous.
Got it.
So things like this are also important risk factors.
So one of the other things that comes to my mind is genetics in this case, right? Because the male had his father who had a very similar situation. Now, I don't know why he got it that early, but like you said, many cases are coming in the 30s anyway. So let's turn the risk factors around to understand how they contribute actually to the situation. So what role does genetics actually play?
Genetics is an important risk factor. You are born with your genes and you can't change. And most of the thing, including your blood cholesterol, is decided by the genes. It's not diet. Like people want to talk so much about diet, but your blood cholesterol is predominantly genetically determined. Now, 1 in 250 would have such an abnormal blood lipid profile, which is very abnormal. 1 in 250. Now, look at city of Bangalore. How many people would have it? and look at people of India
Okay.
and how many. So
Yeah.
we could have something like 2 CR people in India or 3 CR with bad genes. It's a huge number.
Yes.
These people tend to have heart attack when they are young.
Okay.
The easy test, get your lipid profile done at the age of 21. If you have no family history, the numbers are very, very high. I'm not talking about a borderline high, very high. Then start statin, the medicine for this. Other thing about that's the gene. Yes, genes work at multiple level, but I would want to repeat what I said earlier, where I say, even if your genes are bad, it's a loaded gun.
Yeah.
Trigger is still in your hand. Most of the time, trigger is either stress or even running marathons, physical stress, emotional stress, or
and we'll talk about that.
Smoking,
those are things we'll talk about. So,
or smoking, which are the trigger for young people to have. Again, heart attack, it's important to understand when you have blockage in the artery, it's not one, it's two diseases. In one, people present with heart attack. In one, it grows slowly, and they start getting chest pain while walking. Treadmill picks it up. It's what we call as a stable disease.
Okay.
But plaque rupture is the reason for heart attack. That means there is 10% or 20% block, and suddenly the covering of that feels that I've had enough. Today is the day I will just crack. When it cracks, the clot forms on that.
Interesting.
Now, most of the time, we don't know why it cracks.
Yeah.
Smoking is one risk factor. Extreme physical exercise, emotional stress, or reason unknown. The cracks occur.
Okay.
Now, only way not to have crack is not to have disease at all. But most people do have disease.
Okay.
The point I'm trying to make is, imagine I meet a person of heart attack who has had a heart attack today, but I meet him yesterday. What is that I would look for in that patient?
Okay.
How would I guarantee that patient that you won't get heart attack tomorrow? How do you pick tomorrow's heart attack? Is difficult, but that's the discussion we should be having.
Yeah. So prevention is identification and prevention. Right? These are the two things. So I want to just sort of bring the risk factors to a closure, and then I'd love to talk about this as well. How does stress actually impact or exercise? Let's talk about stress and
exercise together. Yeah. So I think stress is a trigger. It's believed that acute stress means sudden stress, like family death, things like that, can lead to suddenly things like heart attack.
Yeah.
Chronic stress, long-standing stress, the blockages tend to grow slowly up. It's a chronic stress.
Yeah.
It piles up, and then the blocks can form. So acute stress, chronic stress.
Yeah.
Now, exercise is a very good remedy for most of the heart disease and other diseases. I could list the benefit of exercise. Exercise first is how much?
Yeah.
It should be like a prescription again. It's not random.
That's a very nice way of saying it.
Exercise prescription.
Yeah.
So what we encourage is around 150 minutes of exercise a week. Now that's 30 to 40 minutes, 4 days a week. So when we say exercise, it's not about running to gym, building muscle, looking good. They are byproducts. The main health benefit is that lot of things get controlled if you exercise. So if I grade, I've used this multiple times, if I grade exercise between 0 to 10, 0 to 1 has maximum benefit.
Okay.
That means do something versus do nothing.
Yeah.
Again, extreme exercise like marathon are harmful.
Yeah.
So doing something versus doing nothing has maximum benefit.
And when you overdo marathons, are we saying that marathon for everyone is harmful, or for those who have predisposition?
Yeah. See, for predisposition, it is bad, but running marathon as such is not a beneficial
It's a very
thing.
controversial thing, right? A lot of people are going to be upset hearing
I
this.
know, but it is an addiction and we should accept. A lot of people.
Marathon is an addiction.
Otherwise, why would you run it? No? They get a kick out of it, and that's why they run it. I'm not discouraging marathoners. I want them to think that you're not doing it for health benefit. That is number one. You're doing it because you love to do it, which is okay to do it. Train yourself well.
Yeah.
Do not have short-term plans. I don't want you to think, oh, next month there is a marathon. I have not run for 1 year. I want to run.
And a lot of people do that.
Yes.
Yeah.
And whenever when you're doing marathon, it's all about mind versus body there.
Yeah.
When you feel, oh my God, I'm going to have a problem, stop.
Yeah.
It's okay to accept that. So I'm not for or against marathons here. I take it as a sport.
Yeah.
I am telling you that running marathon is not something which is of health benefit.
Okay.
But you could do it for all other. So, I mean, look at bungee jumping. How can that be good? But I'm sure marathon is better than that.
I don't get it.
Yeah,
I don't get holding onto a rope and just jumping off, right?
But people do it, right? So, should we tell do or not do? No, that's not. All you could say is you're not doing it to prevent a heart attack.
Yeah. Got it.
You may be doing it to get a heart attack. Definitely not to prevent.
Yeah.
It's okay to do a lot of things.
Yeah.
It's okay to be disciplined. But you know what we know?
Yeah.
Marathoners look 5 years older than their counterparts.
Oh.
They don't look younger. Their body is not younger. Having
lot
said
of
that,
tears and
tear, wear, injuries. Not against this, but do it well.
Yeah. No, that's beautiful. The last thing on risk factors is nutrition.
Yes.
Right? So what role does nutrition play in heart health?
Yes. This is where I think we need to go back, Mohana, and in our previous conversation, you bought it, that we need to go back to our grandmothers.
Yeah.
The balanced diet is the way. So let me talk about one or two myths quickly. The key myth is that eating cholesterol is bad.
Okay.
That means oil is okay, fat is okay. Okay, I'm not telling overdo it. Non-veg is okay, egg yellow is okay, peanuts are okay. Whatever you think is bad is all okay, because oil itself is okay. What is bad is carbohydrate. Having too much carbohydrate is bad. The rule is make it 1/3 of your meal.
Yeah.
Have a lot of fibers, lot of protein, lot of vegetables.
Okay.
Make sure your protein intake is at least 1/3. Indian food is predominantly protein deficient. It is carb rich. Why is a shift in this thinking? It's not a new shift, but it is a shift. Is that cholesterol is produced by your own body, by the genes which we discussed. Whatever you eat, cholesterol will be produced.
So you don't need more of it.
You don't need external cholesterol. External cholesterol might actually decrease internal cholesterol.
Okay.
So carb is the one which is taken as a fuel, and body fluid prepares cholesterol.
Yeah.
There are 27 steps by a healthy liver to produce it. If your liver is healthy, it will produce cholesterol.
Yeah.
So that is the message. If I can extend that message, is that, but if your blood cholesterol is high, we touched upon that, and it's because of the genes and genetic, then if a doctor prescribes a medicine for that, don't fight with the doctor and the medicine. Because as a race, we self-sympathize.
Yeah.
We see, why me? Why should I take medicine?
Yeah.
What is the side effect?
Yeah.
The message I want to give is, most doctors would have thought of all the possibilities and would have given this thoughtfully, understanding your lifelong risk of taking.
But doctor, I do want to say that, yes, you take your medicine, but that doesn't mean you stop taking care of everything else. You have to eat better. You have to, it's a holistic process.
Absolutely.
Right?
I can't deny that.
Yeah.
Whether it is this disease or any disease, lifestyle is a must.
Yeah.
Because these are lifestyle diseases.
Right.
Tablet is add-on. It's never replacement. I think you brought it out very nicely, Mona. It's not a replacement.
Yeah.
Tablets don't work if you don't do lifestyle.
Yeah.
But just taking an offshoot from that, when it comes to cholesterol, tablets are must. Lifestyle goes down there. Just for cholesterol.
From a
Prioritize it. So whatever medicine doctor gives, you should take it for life.
Yeah.
But there's no short term.
Yeah.
You can't get the value down 3 months later and tell, oh, my value is down, now I can stop.
Also, it's a lifelong if you have high cholesterol and you're given medicines,
it's always for life. If you don't take for 3 months, jokingly I say your heart attack is postponed by 3 months. How does it help? You're taking at 30s this tablet to prevent heart attack in 50s. 3 months doesn't mean anything.
Yeah.
I don't know whether you can have one foreign vacation maybe in that period, but for life, it doesn't matter. So what I do to my patients is I understand their concern. I tell them, try lifestyle, because there's no short-term goal. This is a true marathon for me.
Yeah.
Convincing people to take a right lifestyle, right medicine for life is a marathon.
Yeah.
I tell them, don't worry, you try, lose 5 kg weight or 10 kg weight, exercise, do whatever fasting, food fad you have. Come back to me after 3 months, do a cholesterol. But now, and if you're lucky, maybe it will come down. I'm ready to give it that to you. And if it comes down, it's okay. If it is not okay, let's see what to do.
Got it. Yeah. So, yeah, fair enough. Because there's a lot of different alternative thought processes.
Yeah, absolutely.
Days, right?
Absolutely.
And there's also a lot of criticism against mainstream medicine also, right?
Yeah.
So there's an evolution happening in all ends.
Yeah. But I think that's where you are doing this podcast, Mohana. Because there is so much information like we discussed. And today, anybody sitting anywhere can take this one and live stream it.
Yeah.
We need to understand who is speaking, what authority are they speaking, why they're speaking. Now, sitting today here, I also have opinion on cricket. Will it make it right? My opinion. You don't even know whether I play cricket or no. But I could say, it's bad, or football, or earthquake in Greece. I could speak about it. But I'm not the authority on that. So when it comes to health, my respect to people, and that's your intention, is to go to the right source and understand, and not, we need to have this one, the right source, right approach.
And basic understanding of variety of things.
Yes,
right? From
absolutely.
The right person.
Yeah, from the right people, yes.
So, doctor, I want to talk about what you mentioned before, right? If I meet someone today, how do I know that they're going to get a heart attack tomorrow? So let's talk about identification.
Yeah. So here I'm not talking about the predicting, this fellow has 70% heart disease or 80% heart disease, blocks. That's different. The thing is, I think the key point, without alarming people, is all of us are at risk.
Okay.
Like,
sure.
I can't predict tomorrow whether I'll have or you have. So we are at risk.
Sure.
We should understand we are at risk. That means if there is a symptom which I think or you think is unusual, I've never had it before, don't think it is gastric and sit at home. Go to the nearest hospital, get a ECG done. I think the key message which is coming out from our discussion is no age is immune.
Sure.
That's the key message. And if you think you have some discomfort in chest, something in the hand, something in the neck, and you're sweating or you're just not comfortable, go to nearest hospital, get a ECG done. ECGs miss heart attack only in 4%. It's a very small number. Missing a heart attack.
Correct,
They miss blockages, but not heart attack. When you do that, 9 out of 10 times, it will be gastric and you'll come back. But it matters in that 1 out of 10. Because as I said, 1/3 of them don't reach. So don't neglect. That's the first message. Don't self-diagnose at that point. So that's, I think, something which people should take. Imagine, but look at people who think, will I get heart attack? There are, people who are worried. For them, the things we do, one, obviously the lifestyle exercise. We tell them it's the lifestyle, manage it. Second thing what we do is tell them to get their lipid profile done. The blood test. And if the lipid profile, LDL, that's the only number we look at. And it has to be direct LDL because most labs do calculated. Again, you're basing so much decision on a number. Let it be done properly. So ask for a direct LDL. And based on that, if it is sky high, start a treatment immediately. If it is borderline high, start lifestyle. Repeat the number after 3 months. So the single risk factor is there. And if it is low, you're lucky. You could wait. Maybe repeat after 3 to 5 years. If you're diabetics, control them. If you're hypertensive, control them. Don't accept a little abnormality. Like chalta hai kahin. If we want the BP to be 130/80, let it be 130/80 at home. 135 on a regular basis is not good. 140 on a regular basis is not good. Don't fight the tablets, fight the disease. That's what I say. Then for a select subgroup, I wouldn't say for everybody, people who run marathons, people who have family history, people who have a lipid which is borderline, we advise CT angiogram. That's the test which comes. Again, I'm repeating, it's not for everybody. A CT angio, if it is clean, 0 block, 0 calcium, both should 0. The next 5-year heart attack risk is negligible.
Okay.
And you repeat one more after 5 years. Even if that is zero,
Yeah.
then next 15 years, it is negligible. So there is a 20-year bonus you get by 2CT.
Interesting.
So what I would suggest is, but not for everybody. You have to get it recommended. Or if you are in a job which is stressful, you are moving around, I think it could be a worthwhile option to do that. But I like the point you said, there's no substitute to lifestyle.
Yeah.
Tire puncture can happen if you are not careful. All of us are risk. All tires can have puncture, but it's more common if you're not careful. And once there is a puncture, it can repeat. So avoid the first heart attack, because once you have it, you are at risk for one more than your colleagues.
These are very valuable. There are 3 important tests in 3 different scenarios, and I think we will ensure that we will share it as wide as possible.
Yes.
What about are symptoms different for women and men? Can you tell us a little bit about that? Because that will really help people self-understand their bodies, right? Yeah.
I think this is, again, a very important. Heart attack is common in women. They are not fully protected.
But more men get heart attack, no?
At a younger age. But if you look at, like, when women die, I mean, I know sometimes these are morbid topics, but we are going to die. That's the first exception. 1/4 of them also die of heart attack. So it's common, but it occurs 1 decade later. Men could get at 50, women will get at 60, because during reproductive age group, they are protected. But supplementing hormones, there is no protection. It's only natural hormones which help. HRT and things like that harm. They harm heart disease. They harm this. So it's
only for cancer patients now.
That's a therapy. This is, you're taking HRT for whatever reason.
Yeah, and it's become common in the US, right?
Yes, but it is for specific indication. Thinking that HRT will protect.
HRT, for the benefit of the listeners, is hormone
replacement therapy post-menopause. Yeah, I'm sure you'll have a wellness person to have a bigger talk about that. So let's come back to this topic. Now here, so women also get heart attack. One, yes, they are reproductive age group, they are protected, but it catches up. So that's the second point. Third point is women with risk factor. That means if a woman has diabetes, hypertension, smokes, or bad lipid, all the benefit is lost. They are as bad as men, or they are worse than men.
Got it.
So that's the point which we should understand. Next, symptomatically, women present differently. They could have little more atypical symptoms. They may not have chest pain. They might have fatigue. They might have breathlessness. So they have to be more sensitive.
I had no idea about fatigue.
Fatigue, breathlessness, just tiredness. And that could be hard. Okay?
Really?
They could sweat abnormally. So it's important to be a little more cautious, understand your body. That's why the key thing I started telling, the symptom which you have not felt before or which doesn't seem right is the symptom.
And is that supposed to be an acute one, or will it like prolong?
Both are possible, but we are more interested in preventing heart attack. That's the time bound. The other one, when you go to doctor, they will do a treadmill or something and pick it up.
So for example, doctor, just for the common understanding, right? If I am feeling tired, severe fatigue, it could just be for one day and I get a heart attack, or should we notice that it's happening for a long time?
If it is a new symptom and if it is something which you don't like, you feel I'm bad, it's worthwhile to meet a doctor. I mean, it's not that, again, as I said, 9 out of 10 will not be heart attack. I'm not equating both. All I'm saying is it could present little differently. Heart attack could be silent, like you said, which is also dangerous. So it's important to understand your body. I think that's where knowing your body, understanding what each of them does.
So for women, it's not necessary that you get your left arm pain, chest pain.
It's possible to get that, but it could be a little more atypical.
So men typically end up getting left arm pain, chest pain.
Yeah, I could describe it. So chest pain, which is like vague, it's not chin like kind of pain, it's vague everywhere. There is heaviness, baripan they say in Hindi. There is radiation to the left arm inner side, not outer side like this. It could go to neck, it could go till umbilicus. Like a feeling of, you don't know where it is uncomfortable.
Got it.
But gastric also can present the same way. It's not that this would be, except the radiation. If there is any sweating, take it very seriously. But take these symptoms seriously. Do a ECG. I mean, there's no harm. Nobody's judging you because you
Yeah,
went
yeah.
in the night and did a ECG.
I
right?
mean, we go for so many different tests. Why can't we
Yes,
do it
why
when
can't
it's
we do
really
it?
necessary?
But when you have symptom, ECG has to be when you have symptom, not when you're fine.
This is really helpful, doctor. But I want to move to the last part. We've sort of talked about so many important things, right? And I really thank you for that. How do we then take good care of ourselves, right? How do we promote a good heart? So let's say between 20s and 40s as an age group, we'll just target that, right? What should people be doing? Because
Yes.
India is struggling with younger, I think that's more critical. And then we'll come to 40 plus as well.
I think it's important to start at this age. I totally get your point. It's lifestyle, right? When you say lifestyle, multiple things. For youngsters, the key thing is stop smoking. That's the key thing. Second thing is exercise regularly.
Yeah.
When you say regularly, maybe 4 days, maybe 3 days. Don't say job is busy. Yes, it is busy, but steal some time for yourself.
Yeah.
It's important that at least half an hour to 1 hour is yours at some point. Third is eat right. When I say eat right, make it low carb, don't make it low fat. I mean, it's okay to have average low carb diet. Take regular breaks, do some stress management like yoga. Meditation. These things really help. Doing all this, going up and down. These are the things I think which really help. Enjoy your job. It's
that
important.
mindset, right?
Yes, it's a mindset. It's enjoy.
Yeah.
Don't be a cribber. No.
Yeah.
I mean, everything builds up. It's important to find your path and do. And because it's a lifestyle.
Yeah, I love it. And 40 plus, what do people need to do?
Again, I think 40 plus, listen to your body. Again, I'm coming back to marathon. Marathon is supposed to be part of midlife crisis. More 40-year-olds run marathon than 20 years. Yeah. So again, because it's something they want to achieve and prove, listen to your body there. You're 40 plus. You're not 20 now. Every step you take, like you want to, if a 20-year-old can train marathon in 1 month, you need 3 months. If he needs 2 months, you need 6 months. So 1/3 of the pace is important.
Yeah.
Think of yourself that, I could be having minor blocks. How do I prevent a heart attack?
Yeah.
No rash things. Doing things slow, working. Again, risk factor.
Yeah.
Maintaining ideal body weight.
Yeah.
Eating right, as we discussed. Exercising. Everything becomes important.
But it takes a little longer. So you need to have continuity in what you do, right?
Yes. Little bit good habit on a long term is what you
40 plus.
40.
And a related thing, but an important one is I probably have had a heart attack. How do I ensure I don't get another one?
That's a very, very important thing. There, the top of the line is don't stop your medicine. That's the top of the line. Because stopping medicine is a short way of getting one more. Keep your risk factor. That is the one. Never stop your medicine unless you talk to a doctor. That's key. Second, obviously, everything else comes. Lose weight, exercise more, take life cool,
Yeah.
Definitely don't smoke.
Yeah.
Okay, keep the numbers low. Then the numbers come there. Because you're now meeting. Make sure your cholesterol is really, really low.
Yeah.
I would prefer LDL less than 55.
Okay.
Which is just not possible without drugs.
Yeah.
Which a healthy person need not do that. But a person with heart attack needs to do that. Not stop your blood thinner. Exercise. Take it as a new life. Live a new life.
And what's your opinion on technology wearables?
Yes. Yeah. They're good, but they're also bad. In the sense, they're good because they give you some goals, they make you exercise, but don't target every number there.
Yeah.
See, again, I like to quote statistics most of the time. 5% is error in statistics. So if you are given 100 data, 5% of the data is not right.
Yeah.
Why is it not right? Because you have taken 100 data.
Yeah.
There's nothing to do with the data.
Yeah.
So don't target heart rates. Don't target heart rate variability. Target BP. Target sleep quality. But don't, macro manage it.
Yeah.
Don't micromanage
and go crazy. Right?
Yes.
That itself causes stress, right?
On a joke, when people come with those watches and I tell them that just donate it to me. You go back. Because if this is the cause of your pain, just donate it.
But also, why are we, fundamentally, I don't understand it, right? Because I don't wear it. And I'm of a school of thought that I need to pay attention to my own body.
Yes,
And every data is not necessary.
Absolutely. Every data is not necessary. But if there are people who would want to use that data for their benefit, I'm okay with that.
Yeah.
But have a macro approach on that, not micro.
Yeah.
You can't say that, oh, yesterday my BP was 122 and you know, today is 124. You know, creatinine was 0.8 and today is 0.9. Within normal, don't give any importance. When it is grossly off normal, only then. Because wearables pick up much more than what we are supposed to pick up.
Yeah, no, that's wonderful. So on that note, like the heart part, right? We conclude. It's been really, really enriching. Vitamin B has 2 or 3 questions for you, doctor, so that our audience, you know, sort of knows you as a human being, as a person beyond your role as well. So I know that being a doctor, you naturally give back to people and to society. You're creating a difference, right? But what else do you do? Do you have any approach where you actually take time to serve society or give back and create a social well-being?
Yeah. I think this is a good question. So I've started now an NGO, my own. It's a trust. I wouldn't call it an NGO, where we put some money, we collect some money. We have been associated with some rural programs. So there are few organizations which are already doing so. I don't want to be the I don't want name or fame through that.
But that's your approach.
Yeah, we just give some financial support to them. And I want to, more like adopt some villages, see what's, what's happening. So whatever we could do in the back channel, that's what we want to do. Some of the poor patients who come to us, whatever help we can do, we do that. There are times when we write off the bills using the fund which we have. And that's what I've been doing. And also, I see one more thing as in society. One is there's so much you can do as a person. Within me, I think I'm a teacher. So I want to teach many more people, make them good, so that they can give much more to society. And when I teach, I tell them it's not just cardiology. I want to teach you a life skill, how to behave with people, how to talk, how to help them. So that I feel is one more way. So I have my people now, everywhere doing good work. And it's very reassuring to know that they're actually doing very good work there.
Yeah, that's lovely. What's the mantra that you've used in your life for building financial well-being for yourself?
Yeah, that's again I think these are interesting topics. I feel financial well-being is very, very important. And as I can say as doctors, the financial knowledge is very bad. And it's bad in the general public also.
Absolutely.
People fall scam to so many things. It's important to think of marathons in this regard again. Have a long-term goal. If you don't utilize compounding, you're not going to make wealth, financial wealth. So I think as a general rule, which people would have told, it's a good idea to save 10% of your money every month. And I am a believer of the markets in general. Not today, not tomorrow. But I am a believer that market is one which could give you inflation, return beyond inflation. I think 10% putting, without thinking, just putting it separate, thinking that you have had a party, and maybe putting in something like mutual fund if you're not fully aware is probably the best way. Because markets have done well. Some years down, they have done well. And have one proper house, because there's no price to house. I think that's the way to look at
That's your mantra. Nice.
That's my mantra, and I think that should be the
approach,
way.
Right?
And also, this is something which I quote all the time. It's mathematics again. So it's say 0.999, which is just short of 1. Power of 365, which is number of days in the year, is 0.02. 1.01 to the power of 365 is 37. So see 0.02 to 37. What I tell people is define your 1. This is my 1 is not your 1.
Absolutely.
Just little more than that. And do it consistently. Whether it is exercise, whether it is your career, whether it is your finances. I can say 1,000. Let me say 1,100.
Yeah.
You know, little more than what we
Yeah.
can do actually brings amazing. Even exercise. I can walk 20 minutes. Why can't I walk 25?
Yeah. Yeah.
That little extra, I think, and consistently, that is the true power of compounding.
Yeah.
In my
That's a
opinion,
nice
it's not
attitude to
8%, 9% in the market.
Yeah.
True power of compounding works everywhere.
Yeah, that's beautiful. And I'd love to close by understanding how a doctor like yourself, who's so busy all the time, how do you take care of your emotional health and your physical health?
I think this is very valid. I always believe I may not be doing it fully correct, but I want to do right. So when it comes to emotional health, there is, if you ask me, yoga, meditation, exercise, break from your work, enjoy your work. This is the this one, and these are as good as a tablet.
Yeah.
Like if somebody has an anxiety prone, these work as good as an antidepressant or an antipsychotic. But you have to do all of them.
Yeah.
Other thing, what I believe is I'm a spiritual person, so I like to connect. I mean, spirituality, for me, it is divinity, but for many, it need not be divinity. There could be atheists.
Yeah.
But spirituality is still believing in something, some principle, some thought. It's important to connect.
Yeah.
Here, I mean, this is a beautiful, this one from a person, which has come in YouTube, so-called a quadrant approach.
Okay.
I love that. It's not my own. So one of the quadrant is financial, one is physical health, one is spiritual health, and one is your social circle. So there are so many things. So you should remember the job is only for financial. There's family and friends. There's your body.
Yeah.
There's also your mind.
Yeah.
So I think it's important to divide time and, not allow. If I can just be very generous in stating, 90% are just stuck in the first quadrant.
And it's also because we're a growing country, we're more younger people, the maturity comes with time.
Yeah,
right?
I agree.
You need that experience to fail a few times, to recognize that there's something above you.
Yeah.
I think it takes time. Yeah. It was beautiful talking to you, and we have learned so much, and I'm sure our audience will benefit a lot. Thank you for taking time in your busy day, Dr. Ranjan, and joining me as well.
Thank you. It's a pleasure. It's been a pleasure.
Great.